Hello everyone, and welcome back to the channel. In today's video, we're going to break down an in-depth case study of metastatic prostate cancer, looking at diagnosis, treatment plans, and the patient's journey with this condition. We'll also be diving into the medical side with stats, evidence, and treatments that could be applied to similar cases. This video will help you understand how prostate cancer can progress, how it's treated, and the important factors that influence a patient's prognosis. If you or someone you know is dealing with prostate cancer, this video is going to give you insight into what you might expect on the road ahead. So grab a seat and let's get into it. First, let's talk about the diagnosis. Our patient, a 68-year-old male, was diagnosed with metastatic prostate adenocarcinoma, a form of prostate cancer that has spread beyond the prostate. Specifically, he has a T3B N1 M1b classification, which is significant in terms of its spread. This classification is broken down as follows. T3b/4 means the cancer has spread outside the prostate to nearby structures, such as the seminal vesicles. N1 indicates that cancer has spread to the lymph nodes. M1b shows that the cancer has metastasized to distant parts of the body, particularly the bones, in this case. The Gleason score of 4+4 gives us a sense of how aggressive the cancer is. A Gleason score of 8 is relatively high, suggesting that this cancer is more likely to grow and spread quickly. Looking at the CT scans from September 2024, we can see that the cancer is extensive. It's infiltrating the seminal vesicles and is close to the rectum. The cancer has also spread to the iliac chain and para-aortic lymph nodes, which are critical sites for metastasis. The imaging also shows bilateral moderate hydronephrosis, meaning there is swelling in the kidneys due to blockages, which is not uncommon in prostate cancer. Now, let's dive into the treatment plan. The patient's journey began with an orchidectomy, which is the removal of both testicles to reduce testosterone, a hormone that fuels prostate cancer growth. He underwent this surgery in September 2024, and it has led to some improvements in his symptoms, particularly with pain. Post-surgery, he started palliative radiotherapy to the left pelvis. This involves delivering 8 gray of radiation in 1 fraction to target pain and shrink tumors, and it was administered in October 2024. This approach is common for treating metastatic cancer, particularly to alleviate pain in areas like the pelvic region. In terms of systemic treatment, he's receiving docetaxel, a chemotherapy drug, and darolutamide, an anti-androgen therapy. These are frontline treatments for metastatic prostate cancer. Docetaxel has been shown to improve survival rates, particularly when used in combination with hormone therapy like darolutamide. Speaking of survival rates, a recent study published in the New England Journal of Medicine found that patients with metastatic castration-sensitive prostate cancer treated with docetaxel and androgen deprivation therapy had a median overall survival of about 57.6 months. This is a significant improvement compared to earlier treatments. Additionally, the patient's medical team has requested BRCA mutation testing, which is becoming increasingly important in prostate cancer treatment. In fact, studies show that men with BRCA mutations may benefit from PARP inhibitors, which can slow down the cancer's growth. Now, let's talk about prognosis. Metastatic prostate cancer is generally considered incurable, but it is treatable. In Nick's case, the average prognosis could be around 4 to 5 years, though it varies greatly depending on the individual response to treatment. However, there are patients who live longer than the average, especially with new treatments and clinical trials improving survival. It's also crucial to monitor PSA levels, which in Nick's case have dropped from an alarming PSA of 4,042.6 nanogram per milliliter at diagnosis to 868 nanogram per milliliter at his last check, showing a positive response to treatment. On the other hand, some patients do not respond as well to these treatments, and survival may be shorter. The overall survival rate varies greatly, but prostate cancer is the second leading cause of cancer-related death among men in the U.S., with an estimated 34,000 deaths per year, according to the American Cancer Society. Now, let's touch on the side effects. Nick has been experiencing hot flashes, a common side effect of testosterone suppression therapy. He also has some loose bowel motions, likely due to chemotherapy, and he's been taking loperamide to manage it. The constant balancing of treatment effects, side effects, and quality of life is crucial, and it's great to see that his treatment team is staying on top of it. It's also important to note that supportive care is a big part of managing prostate cancer. This includes things like nutritional support, exercise to maintain strength, and mental health care to deal with the emotional aspects of the diagnosis. As we wrap up today's case study, it's clear that treating metastatic prostate cancer requires a multifaceted approach. From chemotherapy and hormone therapy to palliative care and supportive treatments, every patient's journey is unique. Nick's case is a great example of how treatment plans are personalized to each individual based on their medical history, cancer's progression, and available therapies. Nick is continuing with his treatment plan and will undergo more scans and checkups in the coming months to monitor his progress. It's not an easy road, but with the right treatment, support, and care, many patients can live well with metastatic prostate cancer for years. Thank you for joining us today to learn about metastatic prostate cancer and the treatment journey. If you found this information helpful, don't forget to like, share, and subscribe for more educational content. And of course, if you have any questions or want to discuss further, feel free to leave a comment below. We'll see you in the next video. Or want to discuss further,